Hi, my name is Jaideep Herbert and I am a healthcare expert for World Skills Competition from India. Today I would like to discuss with you and give some insights on to you how the COVID pandemic has given the impact on the nursing skills and the learning of the nursing skills for the nursing students. Well, we all know that COVID-19 is a public health pandemic and a global crisis that affects every aspect of our life, including the educational system. It caused chaos, compelling the educational institutions to suspend their regular physical activities, and especially for nursing institutions, when the world was looking for the more and more nurses during the pandemic to take care of the patients. Many nursing institutes started switching their traditional teaching to the virtual education methods to cope up with the educational loss due to the lockdown. But we all know the nursing profession is based on training, not on teaching only, where the students have to learn the skills by performing the hands-on practice to deliver the better patient care. The theory content that was previously taught only face-to-face lectures had to be quickly converted to the online delivery, and teachers were trained to deliver the online sessions whenever it was necessary. Yes, this solution, however, limited to the skills development and clinical practice placement of nursing students. But of course, I must say that the nursing is an art where the candidates or the nursing students, they require the skills by hands-on practice for the better patient care. You know, as per the WHO, there is a global shortage of healthcare workers, and among them, the 50% of the nurses and the midwife shortage is there in the current scenario. And you know that the WHO also tells us about that by 2030, there is a shortage of 9 million nurses in all over the world. Therefore, you know, after the pandemic, what happens that the hospitals are also looking for that the more and more nurses, but they also have that the scarcity during the pandemic, that what kind of the nurses and the healthcare professionals has been trained. But still, many countries have given the relaxation for the requirement of nursing education and jobs, aims to injecting more and more nurses into the healthcare system, which is growing and stretching day by day. While grateful for the availability of more nurses to mitigate the situation, but the healthcare industry faces a dilemma of accepting newly graduate nurses who have been trained in a different circumstances during pandemic. And also it poses a risk of lack of confidence in the healthcare system. Yes, so keeping the current situation in mind and looking ahead, nursing education system must be embraced clinical skills-based learning approach. In addition, I must say the skills-based training has been consistently recognized as an asset in medical and nursing education. Therefore, the simulation-based training was adopted to address knowledge gaps and also train redeployed clinical staff in the new roles. Today, I would like to convey the message to all the experts and the competitors of the World Skills Competition that do not think that this is only just a competition for you and for your country. But remember, you are a champion to spread the message globally and encourage the nursing students to develop your modern clinical skills, as the world is looking for the skilled and competent nurses for better patient care and for well-being of patient with zero harm. So thank you so much.